You pay for health insurance every single month, rain or shine, sick or healthy. And yet somehow, when you actually need it, you still owe hundreds, sometimes thousands more. It feels backwards. You're already paying. Why does getting care cost extra on top of that? The real reason is much bigger than a greedy doctor or a confusing bill. It's built into the entire structure of how healthcare gets paid for in this country. Start with the premium itself. That's the amount you pay just to stay covered. According to the Kaiser Family Foundation, the average annual premium for employer-sponsored family health coverage has climbed for years, often outpacing wage growth. Employers usually cover a large portion of it. You never see the full number, but it's still there, quietly built into a job offer that could have paid you more in cash instead. Then there's the deductible. This is the amount you pay out of pocket before your insurance starts covering costs at all. Miss that? You're paying full price for care, even though you've been paying a premium the whole time. Two separate bills for the same coverage. Why does the system work this way? Here's the reframe. Health insurance in America isn't really the car or your house. Car insurance mostly covers rare, expensive events, a crash, a theft. Health insurance is expected to cover everything, from a yearly checkup to a major surgery. That means insurers are pricing in nearly certain future costs, not just rare disasters. And pricing in near certainty is expensive by definition. Now add the hospitals and providers into the picture. Unlike most goods you buy, healthcare prices are almost never transparent upfront. The Government Accountability Office has published findings showing that the price for the exact same procedure can vary wildly between hospitals, sometimes even within the same city. Insurers negotiate discounts behind closed doors. Those negotiated rates become the baseline. If you're uninsured, you often get billed the sticker price, the highest number on the list, before any negotiation happens at all. Why do prices vary so much for the same procedure? A lot of it comes down to negotiating power. Large insurance companies can demand steep discounts because they bring millions of customers to the table. Smaller insurers, and definitely individuals, have far less leverage. The system rewards scale. It punishes anyone standing alone. There's also the layer most people never think about: administrative cost. A study published in the New England Journal of Medicine found that the United States spends a significantly higher share of healthcare dollars on billing and administration compared to countries with single-payer systems. Every insurer has its own rules, its own forms, its own approval process. Every hospital needs staff just to navigate those different rules. That complexity isn't free. It gets folded into your premium. So who actually benefits from this complexity? Not you. Not most doctors, who spend hours fighting for approvals instead of treating patients. The system benefits from friction because friction creates room for higher prices to go unquestioned. When nobody can easily compare costs, nobody can easily choose the cheaper option. What can you actually do with this information? You can't fix the entire system from your kitchen table, but you can choose plans more strategically. A higher premium with a lower deductible sometimes costs less overall if you expect frequent care. A lower premium with a higher deductible can work better if you're generally healthy and want protection, mainly against a major emergency. This is illustrative, not a specific recommendation, since the right choice depends entirely on your situation. You can also ask for an itemized bill before paying anything. Errors on medical bills are common, and simply asking often triggers a review that catches mistakes. You can call your insurer and ask directly what a procedure will cost before you get it done. It's tedious. It shouldn't be necessary. But right now, it's one of the few tools you actually have. The Bureau of Labor Statistics has tracked medical care costs rising faster than overall inflation for years, and that trend shapes every premium you'll ever pay going forward. This isn't a problem that fixes itself through one clever hack. It's structural. Multiple layers of pricing, negotiation, and administration stacked on top of each other, each one adding cost before you ever walk into a doctor's office. This video is for educational purposes only and is not financial advice. Always consider consulting a licensed financial or insurance professional for guidance specific to your situation. So the next time your premium goes up, remember, it was never really about your doctor visit. It was about a system built on hidden negotiations, hidden prices, and hidden costs, all landing on one very visible bill with your name on it.